First, we want everyone who lives in Houston to avail themselves of local healthcare opportunities regardless of their immigration status. We want their kids in our clinics being immunized. We want their kids in the schools, and we want everyone to feel comfortable accessing any city service, whether that is calling the police when you're being victimized or going to a city health clinic, regardless of immigration status. In terms of outreach to the Hispanic community, you need culturally appropriate outreach. And you need to make sure that there is access to clinics in all the neighborhoods of Houston. We've discussed that extensively. We also need to work with the existing community-based organizations like AMA, who already have, who can open doors in the community and already serve those populations. I've had the joy of launching a program called Bank on Houston that it's been targeting the unbanked in the city of Houston. In some minority neighborhoods, up to 50% of the population has no mainstream banking relationship. Means they're carrying around large wads of cash, they're prey to payday lenders and check cashing services, and I'd love the opportunity to talk more extensively about that program, which has been highly successful, run out of the Controller's office. Thank you.
Well, I think I want to congratulate AMA for all that you do in the community, and I've been in your facility a number of times, and I think it's a model for how we do things in the city, except it needs to be on a much larger scale. You have a clinic at AMA that's a joint venture between your organization and Texas Children's Hospital. And we have the largest and probably most sophisticated medical center in the world. And I think the institutions at the TMC need to partner with groups like AMA. And this is one of the ways we're going to expand this network of neighborhood health clinics and services for our children, particularly in the Latino community. I think that the location of these neighborhood clinics is critical. They need to be in places where they can easily serve people and people can have easy access. They know it's there. Because there's so many people that are lost and are not included in our social safety network. And I think that's a great model. We can also engage other community-based organizations like our churches and expand the number of city health clinics. We only have 7 City of Houston health clinics, and you have to make an appointment to go. They don't take walk-ins. See, we've got a lot we can change to remedy this problem. And as mayor, I'll take a very strong leadership role in making it happen.
In my opening remarks, I talked about being a candidate of diversity and opportunity. And here's how it plays out in this arena. I believe that illness, disease, knows no boundary related to race or economic income. And I think I've tried to say in my comments today that much of my efforts are going to be directed to people who are classically called the have-nots or the outcasts or the disadvantaged. And I think some of those programs will work for people of all races, but particularly in the Hispanic community, we have to have efforts that are culturally sensitive and culturally appropriate for the community itself. We need to do more neighborhood services because I think, as I said earlier, it's easier to get the people on their turf as opposed to having them come to institutions that are foreign to them. You have to utilize community-based organizations, and I applaud you for the work that you're doing, and you have to engage the community in discussions of health and wellness. And I think that's the next challenge, engaging communities in discussions of health and wellness.
Well, I was trying to understand this question when I first read it. You know, first it talked about undocumented workers, and then it talked about Hispanics. And so I was trying to differentiate what we're trying to get across here. You know, what is the question? Are we talking about how high is that rate when we talk about the Hispanic community? You know, there's a huge concern. We all care. And Gene just talked about those that have not. We do care. We got to figure a way. of helping them. But the question is, how do we pay for it? We do not have an unlimited bank account within the city of Houston. You do not have an unlimited bank account if you want us to tax you. We have to make sure that we have a plan in place. We have to have private cooperation like they have at the Ripley House, that they provide health care as well. We've got to find that answer. It is a tough question, but we have to work together to find it. If we can come together after Hurricane Rita and Ike, we need to come together on this issue as well and being able to find a way to help those that can't help themselves.